Good afternoon, Professor Gordon Slater here. I'm an orthopedic surgeon based in Sydney with a strong interest in regenerative medicine. Today I'd like to talk about the emerging role of hyperbaric oxygen therapy, or HBOT, in supporting better sleep quality. It's an area attracting growing interest in clinical research, particularly where sleep disturbance is linked to inflammation, hypoxia, or neurological stress. Sleep disruption is common and it tends to become more prevalent as we get older. It can also occur in a range of conditions where oxygen delivery, inflammation, or neurological function may be compromised, including post-concussive syndromes, and in some cases following long COVID. HBOT involves breathing 100% oxygen inside a pressurized chamber. Typically, treatment is delivered at around 2 atmospheres of pressure, which is roughly equivalent to being 30 feet underwater. Under these conditions, oxygen dissolves more readily into the plasma, increasing the amount available to body tissues well beyond what we achieve under normal atmospheric conditions. So how might HBOT support sleep? One proposed mechanism is improved cerebral oxygenation and neuroplasticity. When the brain is affected by hypoxia, sleep architecture can become disrupted. By improving tissue oxygenation and cerebral blood flow, HBOT may help support recovery in brain regions involved in sleep-wake regulation, including areas such as the prefrontal cortex and insula. A second mechanism is reduction in inflammation and oxidative stress. Chronic low-grade inflammation and oxidative imbalance are both associated with poor sleep quality and fragmented sleep. HBOT appears to modulate these pathways by triggering controlled oxidative signaling, which can upregulate antioxidant defenses, reduce pro-inflammatory activity, and help stabilize autonomic function. In turn, this may support a more parasympathetic state, which is more conducive to both falling asleep and staying asleep. A third possible benefit relates to mitochondrial function and hormonal regulation. By improving cellular energy production and reducing sympathetic overactivity, HBOT may help lower physiological stress responses while also supporting melatonin regulation and ventilatory stability. Now, the clinical evidence is still emerging, but the early findings are encouraging. A 2022 randomized sham-controlled trial in post-COVID patients reported significant improvements in Pittsburgh Sleep Quality Index scores, along with reductions in fatigue and psychiatric symptoms. More recently, a 2025 randomized trial in patients with chronic insomnia at high altitude found meaningful reductions in insomnia severity, with additional improvements in mood. Other studies in people with mild traumatic brain injury and in older adults have also reported improvements in subjective sleep quality, less daytime sleepiness, and better overall restfulness. In Parkinson's disease, some analyses have suggested HBOT may improve sleep stability as well. That said, these benefits are not universal. Outcomes vary depending on the treatment protocol, the patient profile, and the underlying condition. Larger and longer-term studies are still needed before firm conclusions can be drawn. At this stage, HBOT should be viewed as an adjunctive therapy, not a standalone solution. It is best considered alongside established measures such as good sleep hygiene, medical assessment where appropriate, and treatment of any underlying contributors to poor sleep. If you're dealing with persistent sleep issues, especially where inflammation, hypoxia, or neurological recovery may be part of the picture, it's worth discussing the options with a qualified healthcare professional. HBOT is a physiologically grounded intervention, and while the evidence is still developing, it may hold real potential in selected patients. Thank you for your attention, and I hope this has provided a helpful overview of an emerging area in sleep health.